An articulation occurs anytime two bones touch each other. Anatomists classify articulations based on structural and functional qualities. There are three structural classifications based on the structures between the two bones in the joint. Fibrous contain fibrous tissue, cartilaginous contain cartilage, and synovial contain fluid-filled spaces. Functional classifications are based on how easily the bones move against each other. Synarthroses don't move at all. Amphiarthroses move a little bit, and diarthroses move easily. There are three types of fibrous articulations. Syndesmoses occur when there's a long set of ligaments between the two bones, such as the radius and ulna here. Gomphoses are a special case where small ligaments connect a tooth to its socket in the bone. Lastly, sutures occur in the skull, where the flat bones are attached by tiny protein fibers. Sutures are syndesmoses, but gomphoses can move a little bit. There are two types of cartilaginous joints. If the cartilage is hyaline, that is a synchondroses. We've seen those already in the epiphyseal plate and costal cartilage. However, when fibrocartilage is found, that is called a symphysis. Here we see the pubic symphysis and intervertebral discs. There are no subcategories for synovial. These are the diarthroses of the body, where the two bones are connected by a capsule that contains a fluid-filled cavity. Instead of one bone moving against another bone, here the bone moves against liquid. These are complex and sometimes fragile articulations with lots of structures. The articular capsule is the connective tissue sheath that covers the two articular ends and the entire joint space. It is lined with a synovial membrane that secretes a small amount of synovial fluid into the joint space. This fluid is fairly slippery but slightly more thick than water. Since synovial joints move easily, this means that the moving bone may rub against other structures like skin, tendons, ligaments, etc. This could potentially cause friction to build up. To minimize friction, there are small fibrous bags containing the same slippery synovial fluid in locations where friction could be an issue. These bursa are associated with all our synovial joints. If the bursa is very long and wrapped around a tendon, it is then called a tendon sheath. A map of articulations. Now let's look at how shape of the articular surfaces affects the way the bones move. As mentioned, synovial joints are the most flexible articulations in the body and noted as diarthroses or freely movable. The shapes of the articular edges always determines the direction of movement. Range of motion, or how far the bones move, depends on many factors. Structurally, the muscle that moves the bone is attached by tendons, while reinforcing ligaments connect the bones, and define the articular capsule. See slide 5 for review. Functionally, the bone that moves when the muscle contracts is the insertion, while the bone that does not move is the origin. Depending on the muscle and articular edges, we would see these movements. Gliding, when two flat surfaces slip against each other. Angular, when an angle is created at the articulation. Rotation, when one bone moves around a pivot point. Specials, these do not fit into another category. Gliding, again, here we see two flat surfaces moving slightly against each other on multiple planes. This occurs in the tarsals or ankle bones to stabilize us when we stand. There are many angular motions. Flexion. The joint angle becomes acute or smaller than 90 degrees. Extension. The joint angle becomes bigger or larger than 90 degrees. Abduction. The bone moves away from the midline. Adduction. The bone moves toward the midline. Rotation. The bone moves around a pivot point, and here we see several examples. Circumduction is a special case of rotation where the bones move as a cone in space. This typically applies to the shoulder and hip joints. Special movements. Depression. The bone moves inferiorly. Here the scapula or shoulder blade is moving down, but we can also depress the mandible or lower jaw. Elevation. That bone moves superiorly. Here the scapula is moving up as you shrug your shoulders. Dorsiflexion. Toes move superiorly or toward the ceiling. Plantar flexion. Pointing your toes like a ballerina. Protraction. Moving your mandible anteriorly. Retraction. Moving the mandible posteriorly. Opposition. Touching your thumb to each finger in turn. Those are a few. Function follows form. These actions are determined by the shape of the articular surfaces. Articulations are the perfect example of structure and function. Playing joints performing gliding actions. This example shows the carpal bones of the wrist. Hinge joints perform extension and flexion. Here we see the elbow. Notice the cylinder in a trough shape. Pivot joints perform rotational actions. A cylinder lies within a tubular structure. Condyloid and ellipsoidal joints also perform flexion and extension. Your knuckles are shown in this example. Your thumb and its carpal are a saddle joint. Imagine two C-shaped structures with one on top of the other. You can move this joint in two directions. Ball and socket joints are just that, a ball within a cup-shaped socket. Specific to the hip and shoulder joints, these are perfect for circumduction. Let's take a look at some of the major joints of the body. Glenohumeral. This is the shoulder joint. It is a ball and socket synovial joint that is the most flexible joint in the body. The margins on the scapula structure are almost flat, and so there's no body structures in the way of the humerus. While very flexible, this joint is not very stable. It takes little effort to pull the head of the humerus past the margins of the scapula and dislocate the shoulder. The elbow is both a hinge and pivot joint. The hinge allows for flexion extension with the ulna moving against the humerus. However, the radius rotates around the ulna for the pivot joint, which produces an action called supination and pronation. While not the most of anything, the elbow is frequently injured with falls. The hip joint is the other ball and socket joint of the body. The socket on the coxal bone has very deep margins. This provides for stability, which means that it is not a very flexible joint. Your femur does not have quite the same range of motion and circumduction as your arm. However, it is very stable. The sternoclavicular joint and clavicles are commonly injured in auto or cycle accidents as seatbelts pull on the articulation or somebody just lands on their shoulder. It is more of a fibrous articulation. The articular surfaces of the structures in your temporomandibular joint are also fairly shallow. It is a condyloid joint and performs depression elevation of your mandible. However, thanks to a lot of muscles and the shallow margins, you can also glide this articulation for protraction and retraction and lateral movement. This joint is the most easily dislocated joint of the body. Also, it's commonly damaged by grinding your teeth at night, and as a result, dentists often check the function of this joint during routine dental visits. The knee has two claims to fame. One, it is the most complex joint of the body, and two, it is the most frequently injured in sports. Your knee is 4 bones in 3 articulations, one of which is outside the joint cavity. It is also weight-bearing, and the mass of your body from head to knee slams down on the tibia with every step. Because of its complexity, it has many reinforcing ligaments both inside and outside the joint capsule, as well as fibrocartilage pads. Tibiofemoral. This articulation lies between the tibia and femur. It is a synovial joint that allows for flexion extension. It is inside the main joint cavity. Tibiofibular. A fibrous joint between the tibia and fibula for stability. It is still inside the joint capsule. Femoropatellar. This articulation lies outside the joint capsule and lies between the femur and patella. Anatomists believe the patella prevents hyperextension. In other words, because it's in the way, your tibia cannot suddenly move in front of your body. There are additional structures here. Within the joint capsule, we see 2 crisscrossed ligaments. The one from the front is the famous anterior cruciate ligament, or ACL. It is short and easily damaged or torn when the knee is twisted, golfing, football, etc. The one located posteriorly is the posterior cruciate ligament. It is a bit longer and less frequently injured. Recall that ligaments and tendons are dense, regular, connective tissue proper. This is not a highly vascularized tissue, and tissue repair here takes a long time and is prone to scarring. The menisces are the fibrocartilage pads between femur and tibia that provide shock absorption. They can also be injured and take a while to heal.